Well, good afternoon, and thank you for coming today. For the last several weeks, I've been raising issues about a common class of medications that are administered and the connection to a very serious hospital-based infection called C. difficile. On April the 9th, I drew attention to the fact that a drug safety and effectiveness network recently set up reported back on this issue and confirmed the concerns that I've been raising for many years, that there's a strong association between these common medications and these hospital-based infections. On April the 30th, we drew attention to another factor. Health Canada has repeatedly assured us that they're on top of the issue, that they're monitoring it through a Canadian nosocomial infection surveillance program, and that they were going to get to the bottom of it. At that occasion, I drew attention to the fact that they did not get to the bottom of it because, amazingly, they did not collect the data on the medications that are on an admission, and therefore, although the reassurances in the report that it's a comprehensive report, that it is probably the most comprehensive one in North America, in fact, and can be used as a baseline for future studies, in fact, is not the case because they ignored a clear and independent risk factor. The literature supports, and the DSEN report shows that it's dose-dependent, time-dependent, a 40 to 270% increase risk of infection. And so my question last week, or on April the 30th, was how is it possible to set up a study to review the issue, to inform the public, and not collect the data on a clear and independent risk factor? Furthermore, there's evidence that these meds are overprescribed. As much as 70% people should not be taking them for dyspepsia or heartburn, and yet they're commonly prescribed for that purpose. So today, I want to draw attention to some further concerns, but also to some promising solutions that, amazingly, people are not advised on adequately either. First to the concerns. I want to draw attention to a further study in the Journal of Clinical Infectious Diseases that notes not only are people more likely to get an infection of C. difficile if they're on those medications, between 40 and 275%, increased risk depending on the time and the dose of the medications that the person is taking, but they dissected the data and found that they're 3 times the risk of complications, and there's 5 times the risk of dying from the infection if you happen to be on those medications. In summary, patients taking an acid suppressant were not only more likely to develop an infection, they're 3 times more likely among those with an infection to have the worst complication. That might include an unnecessary bowel resection, and they're 5 times more likely to die of the infection. Now, this study also reported that there was much greater risk with age. The elderly have more than a 500% increased risk, 551% increased risk if they're over age 80. I say these two issues are almost certainly related because the elderly, it's well known, produce less acid. They're achlorhydric or hypochlorhydric. So there's compelling evidence, overwhelming evidence that this is a serious problem, and to date there has been no adequate warnings issued by the regulatory body, that's the Marketed Health Products Directorate, and the Public Health Agency of Canada. In fact, to my surprise, they even took the one line related to this issue on April 17th. They took it off the website. I don't know how they can explain that actually after the DSEN report, but nevertheless, that's what happened, and they, of course, put it back on. So there seems to be some confusion in the shop about what they're doing. Today, I also want to draw attention to 2 new therapies that have been approved by Health Canada in the last 2 years. The first is a new drug called Difficile, and Difficile is also known as fidaxomicin. It was approved in July 2012. It's a new antibiotic. It says the results are not inferior to vancomycin. We're not sure what the expense of the new drug will be. Vancomycin costs about $70 a day. A 10-day course would therefore be $70. The risk of reoccurrence with vancomycin is about 25%, so you go through a $700 increased expense, as well as have 3 weeks perhaps of extended stay in the hospital, sometimes 5 weeks, and 25% will have a reoccurrence and go through another round of antibiotics. Difficile, the reoccurrence rate is reported to be 15%, and so that would be an improvement over vancomycin for reoccurrence. The adverse effects, I don't know, are adequately known at this time. and the drug was fast-tracked. On January 2013, the Natural Health Products Directorate, that's another branch that is under the Marketed Health Products Directorate, they approved a product called BioK Plus. It's a powerful probiotic. About 50 billion CFUs, that's cluster-forming units, per capsule. The cost is about $2 a day, and if they get 2 capsules a day, starting therapy about 36 hours after antibiotic therapy, the published research indicates they will eliminate 95% of C. difficile with no evidence of reoccurrence and no significant adverse effects. It's been used for 9 years in a hospital in Quebec. That would be Pierre Legardeur Hospital near Montreal. Difficile is heralded as a new third line of defense and a new tool in the toolbox to reduce the risk of occurrence or recurrence. The cost has not been made known, but notice of a patient support program with the cost could be an indicator. BioK Plus has been demonstrated in clinical trials published in the American Journal of Gastroenterology to eliminate 95% of C. difficile infections. Powerful probiotic therapy started 36 hours after starting the antibiotic therapy, and it costs about $2 a day. The authors note that standard treatment with metronidazole, that would be a first line, is inexpensive but has marginal effectiveness. Whereas vancomycin is more effective, but it's very expensive. Furthermore, AAD, that would be antibiotic-associated diarrhea, and CDAD, Clostridium difficile-associated diarrhea, often recur after treatment with either of these therapies, and continued use compounds the growing worldwide problem of antibiotic resistance. There was a lot of attention 2 weeks ago as the World Health Organization released very strong concerns about the growing problem worldwide of overuse of antibiotics and the development of antibiotic-resistant organisms. So while Health Canada does not normally promote any approved product, perhaps with 1,400 deaths a year, even as warnings about risks should be communicated and somehow have not been adequately communicated to the public, perhaps Health Canada should and could develop the tools to communicate positive developments to hospitals, to doctors, and to patients when lives are at risk. And finally, I want to draw attention to the fact that Scotland, recognizing the enormous overprescription of these meds and inappropriate prescription, it's estimated to be 70%, they've already started a pilot program utilizing a specialty nurse that managed to take 83% of a target group off these high-risk and overprescribed medications without adverse effects. This study is published in Quality in Primary Care in 2012. Canada could have been there 10 years ago. We have an opportunity to develop our own programs here in Canada and work with the CMA and other stakeholders to remedy this macabre situation. The CMA has a promising program out there now working with our health agencies. It's called Choosing Wisely Canada, and they're helping patients, doctors have dialogues with their patients on what medications they should and shouldn't be taking to get better outcomes. I would suggest this would be a good candidate to explore with that agency. And I guess I want to sum this up by saying that if the regulator cannot or will not act in the public interest, then it falls to the policymakers to advance the public interest and adjust the mandate of the regulator if necessary. So in raising these concerns, I think we've highlighted a number of issues that are rather alarming. We have different agencies of Health Canada don't seem to agree with each other. Health Canada does have tools to raise alarms, and I think people would like to know. In fact, I put it in my own household over the last 10 years twice, and I asked people if you're on a medication that could increase your risk of an unnecessary bowel surgery or extending your stay from 3 weeks, 3 days stay for your bunion operation or your hernia operation to 3 weeks, and could put your life at risk, wouldn't you want to know? And overwhelmingly, people said they would like to know. I think it's a matter of informed consent for people. They need to know. The false perception that these drugs are well tolerated has allowed to come about in the last 20 years because the regulator, frankly, has not done their job in raising alarms as information has been available. And that has led to a situation where we have widely overprescription of these drugs, which appear to be well tolerated, but in fact, according to the literature, and may in fact be contributing to the very thing they're supposed to treat, because patients readily develop dependence. There have been no adequate warnings, and I think it's past time that we had those warnings, we had a discussion, and we begin to rein this situation in. So with that, I'm open to take any questions.